Hello, my name is Curtis Crane from the Crane Center for Transgender Surgery. I'm a board-certified plastic surgeon and a fellowship-trained reconstructive urologist. Today, I'm here to talk to you about the process of getting a medically necessary procedure covered by your insurance. And the procedure I'm talking about today is shortening of the phallus after phalloplasty. So the typical process of getting an insurance to approve a procedure is pretty lengthy. In 2012, when I first opened the practice, I was one of the first surgeons in the US to say, I will work with absolutely any insurance company. I truly believe these are medically necessary surgeries, and that's why we have insurance. I don't like it when my patients bear the financial burden of these surgeries. I think insurance companies should pay for them. That's why we pay them every month. So when we first opened, we were successful about 10 to 15% of the time having insurance companies pay for surgeries. And then now, 8 years later, through governors changing laws on transgender exclusions and my own practice pushing the envelope, appealing, scheduling peer-to-peer reviews, we're now about 85 to 90% insurance-based. So I'm really proud of that. We've been really successful at getting a lot of patients covered, so all they have to pay is their copay or deductible instead of the expensive costs of healthcare in the US. So the typical process is my team works diligently. They submit a series of codes that will be covered in your procedure. The insurance company approves all of them, approves some of them, or denies all of them, some combination of that. And then we appeal through an appeals process. Then it comes down to, at times, what's called a peer-to-peer review, where me as a surgeon discusses the surgery with a doctor that works for the insurance company. It's typically a primary care doc that doesn't necessarily know the intricacies of transgender surgery, but they understand medicine and medical terms and whatnot, so we can have an educated, high-level discussion on why this needs to happen for you. Usually, a procedure is denied because an insurance company says, well, that's cosmetic. It's just for aesthetics, it doesn't matter. In the case of phalloplasty is a very complex reconstructive endeavor. As a reconstructive urologist, I can say it's probably, if not one of the most complex urologic reconstructions that can occur. And so little touch-ups, small procedures afterwards are very common. It's part of the procedure. If a patient has a phallus that's too long, and there's two reasons for that. One is sometimes we make the phallus longer than the patient asked for, because if there's any necrosis or loss of tissue at the tip, then we have some margin of error to trim back. It could be that the phallus actually got longer because of gravity. The phalluses are typically heavy, especially when they're swollen, and I've seen some patients that grow 10 or 20% over a year's time because of gravity pulling down on the phallus. Or the last option is sometimes patients say, man, having a 6.5, 7.5 inch phallus has always been my dream. We say, are you sure? They say, yes. We build that for them, and then they say, you're right. Please trim an inch or two off. And that happens. That's okay. And so then I'm happy to do that. We submit it to the insurance company, and the insurance says, this is cosmetic. And I say, it's not cosmetic. This patient can't wear normal pants. This patient is actually getting rashes where the phallus is against the leg, which is really common. It would be called an intertriginous area. Any fold in the body. Some women that have really pendulous large breasts, they can get rashes underneath the breasts. This is similar. There's all kinds of reasons we can give the insurance company. And a common example that I use to get around it comes down to rhinoplasty. Some rhinoplasty or nose jobs are cosmetic. If there's a little bump or some kind of lobular tip at the tip of the nose that a patient wants fixed. Their nose is normal, but maybe it's not as aesthetically pleasing as the patient would want. They want it changed. When you take a normal structure and change it to a more aesthetically pleasing structure, then that's cosmetic. The examples I gave just illustrated why a phallus shortening procedure would not be cosmetic. It can be unhygienic. It can be uncomfortable in wearing normal pants. Occasionally, if a urethra is really long, because the phallus is long, there's a lot of areas where urine can trap in that urethra, and then the patient, after they urinate, walks away, there's excessive dribbling, and the patient can't ever wear khaki pants anymore. So I use all these arguments with the insurance company so that they can understand why some patients may need a phallus shortening. So I hope this provides good information for you. My insurance team will work very diligently to try to get your procedure covered. And as always, we're happy to answer any questions that you may have about your upcoming surgery. Thank you.